Welcome to MISurgical. My name is Dr. Jeff Shad, here to give you a tour. Please come on in. We are here at the waiting room of MISurgical, where the patients check in with our awesome front office receptionists and schedulers, wait for their treatment time. This side, we have our chiropractic and physical therapy department, where the patient receives their physical medicine and chiropractic care. Come on in. Here is a typical physical therapy or chiropractic care, a room where a patient receives their treatment on a daily or weekly basis. Here are our dynamic physical therapy room, where the patient performs certain exercises for the body part that was injured with the help of our amazing physical therapists and physical therapist assistants. Another sample of a typical physical therapy and chiropractic room, where the patient receives certain modalities such as ultrasound, electrical stimulation, Russian stimulation for rehabilitation of the injured body part. Here's our X-ray room or radiological room, where we perform X-ray images for the body parts that are in question, and we could diagnose you on spot. It's a digital X-ray. Not that many locations have it. We are proud to have our own in-house X-ray. Here's another treatment room with variety of modalities, ultrasound, and also in this room, we do review your MRI X-ray images to understand the condition that is causing your pain. In this room, we treat the patients with herniated disc in the neck or back. So if you have neck pain and back pain due to disc herniation, disc degeneration, injured disc, whether it's sports injury or gradual onset or a car accident or slip and fall, whatever the nature of your injury is, this device called DRX9000, commonly known as spinal decompression, non-surgical, could decompress your disc of lower back and the neck. So we have two components, and next to it, we do have a relaxing zero gravity massage chair we use prior to your treatment to relax your muscles, heat your muscles, then decompress your spine. This whole side is dedicated to chiropractic care and physical therapy. So let's go check out the medical group side. Welcome to MIMG, the medical group side. Come on in, let me show you around. Here's our provider room. Here we have Nazi Arefkia, our CEO, and Dr. Kevin Burns, our medical director. Here we have our medical consultation room, where orthopedic surgeons, neurosurgeons, pain management doctor, neurologist, general surgeon perform examination for our patients. Here's our administration room, where we do a lot of surgical scheduling. Here's Miss Kelly. She pretty much does all the initial scheduling for evaluation, consultation, authorization, and eventually surgical scheduling. This is a colorectal and general surgical evaluation room, where patients are seen for a lot of the GI or hemorrhoid and colorectal issues. This one is our orthopedic, neurological, and surgical evaluation room. All the patients with spinal injuries, extremity injuries for orthopedic and spinal evaluation, pain management are seen in these two rooms. This is another one of our examination room, where it's used by our orthopedic surgeon and our spine surgeon and myself, evaluating patients for spinal disorders. We're now on the surgical center side, where you come in, get checked in prior to your surgery with our wonderful surgical scheduler and a receptionist, Irma. She would provide the preoperative information and chart and go over your medical record and get you ready for pre-op. We're now going to look at behind the scene where your pre-op and post-op and surgery is going to happen. Come on in. This is one of the two preoperative areas where you get checked in prior to your surgery with our wonderful nurses. This is our second pre-op area where you get checked in prior to your surgery, and you get to meet one of our wonderful nurses, Jenna. And let's move on to the next section. This is our nurse station right by the post-op area, the recovery area, where our wonderful nurse, Amy, makes sure post-operatively everything is perfect before you get discharged after surgery. One person here that's a little shy, but she makes everything happen in the surgery center is Clarissa, our director of nursing. Love to introduce her. She's amazing. This is one of 2 operating rooms where all surgical procedures are done. The types of procedures done in these rooms are artificial disc replacement for your neck and back, joint replacement, pain management injection, colorectal surgery, plastic surgery, general surgery, hernia repair, all with the use of visually assisted equipment such as endoscope, laparoscope, microscope. With the use of fluoroscopic equipment, you're able to achieve the most minimally invasive surgical procedure for you with minimal damage to your body. This is our second surgical room, where, as I mentioned before, similar type of surgeries happen in this room as well. It's just for convenience for patients and surgeons. Thank you for watching this tour. I hope you learned a little bit more about MISurgical and what we all do here. I just want you to know we are all here to help. Please reach out.